These two went from mother and daughter to father and son. How's that possible, you might ask? Simple. It's not. What's up, everybody? Ty Rivera here, the absolute best LGBTQ comedian in the world. Me. I really should have warmed up. Let me adjust my mic. Much better. So anyway, in today's episode of What's Crazy About the World and Why Should We Care, I want to talk about these two, Raphael and Gustavo Batista, which I know I'm being incredibly condescending right now, but it's just because I am tired of these people. It is the parents that usually want these kinds of things to happen, even if they never will admit it. Because the story I'm about to read you guys, just to get to it real quick. Mother 38 and daughter 10 reveal their double transition to become father and son. Okay. Whatever. And I really am usually against even the thought of a person not being able to be with their parents. But I think at the very least, in situations like this, there should be some sort of supervision going on. And I know that I should be very pro letting people do whatever they want, and I am. But I'm also kind of exclusive on that to adults. Maybe I'm old school. Maybe it's a sign of my age. What do I know? I've got gray in my beard. I'm probably going to get rid of that tonight, but I've got gray in my beard right now. And the thing that I'm trying to get at is I am very pro adults doing whatever they want to do with themselves, their bodies, their faces, obviously. I am completely cool with all of that. But I may be old school in my thinking when I say I think that it is a parent's job to a lot of times tell their kids no. I mean, if you want to do whatever with your hair, dress however you want to dress, I'm 100% down with that. My parents were always super cool about that with me and my sisters growing up. We could do whatever we wanted with our hair as far as getting it cut however we wanted. If we wanted to dye it or bleach it, nobody cared. We could do whatever we wanted as far as all that stuff. I just don't understand transitioning your child. And like I said, maybe I'm old school, but I want to read to you really quick the definition of Munchausen by proxy. And here we go. Munchausen by proxy. There is a psychiatric condition called Munchausen by proxy whereby parents crave the attention they get from having a child in need of medical interventions. Those suffering will often intentionally harm their child. The term Munchausen is being applied to parents who appear to meet the criteria of Munchausen by proxy but get the attention they crave by manipulating their child into believing he or she is transgender. Since so many of these parents are mothers, another phrase often used is munchie mom. That sounds kind of cute, actually. She's not abusing her child. She's a munchie mom. What are you talking about? Everybody loves the munchie mom. You thought orange slices were great? Wait until you get injected with some cross-sex cross-sex hormones are the new orange slices. You thought a Capri Sun would change your attitude. Try living as a man. Anyway, parents with Munchausen are energized by the attention they get from having a transgender identified child. In addition to craving attention, which is a hallmark of Munchausen by proxy, Munchausen parents push their children to believe they are the opposite sex for other reasons, such as a parent's discomfort with a gender non-conforming child, which I would imagine nobody cares about having a tomboy, but a little sissy of a son I know has been very embarrassing for some people, but at the same time I can't imagine being like, I'm not comfortable with this shit. You're either going full transition. I'm sorry, the idea is just ridiculous to me to be like, we're having no halfies in this house. This is a home that lives in the binary. If nothing else, we're good Christians and we live in the binary. We're taking you to the clinic tomorrow. A parent's disappointment about the sex of their child. I know you guys don't know this, but I have a really old joke that I never do anymore. And it was about Jazz Jennings.
4 sex change surgeries, quote unquote, and countless hormone treatments. TLC's I Am Jazz star Jazz Jennings still doesn't feel right.
And like I said, it's an old joke. It was from before anybody was even talking about this stuff. I probably wrote the joke in like 2005 because I saw it on 2020.
Their youngest, we'll call her Jazz, is a 6-year-old who has been living with a secret until now.
Your child was born a boy, and now you call him a girl. Yes?
Yes.
Jazz is transgender and one of the youngest documented cases of an early transition from male to female.
And me being gay and having so many trans friends, of course, it caught my attention. And I always got the feeling that Jazz's mom wanted her to be a girl. Well, him to be a girl when he was a little boy. Like, that's the way I felt when I watched that story. A parent's desire for a child of the opposite sex. Well, isn't that kind of the same thing? Why do they list it as two different things? A parent's disappointment about the sex of the child, a parent's desire for a child of the opposite sex. I think they just didn't have enough symptoms for this list, which, like, you don't really need a bunch of symptoms, but they're trying to make it seem more official, maybe. A parent's desire to profit from a child's trans identity. Now, that one I can definitely see being a thing. That one for sure, especially in this day and age. It's just like, okay, this is going to be a cash cow or bull. We don't discriminate over here. But anyway, parents of transgender identified children often garner praise and personal profit by telling the story of his or her child. The stories center around the parents and their perceived virtues for being so loving and affirming of their child. See, now that I can 100% understand as far as what they call Munchausen by proxy. It's just something people call it. I don't believe it's made it into any actual medical journals. It really is just kind of one of those things where it makes sense because these people are so deranged, if you ask me. And I'm really not trying to be judgmental, but if you guys are new to the channel or you don't know my history, when I was young, I thought I was a girl. It was this thing that got in my head because my sister told me something. I've been over it several times. Take my word for it. Because I've talked about it enough and I don't really want to go into it too much right now just because the people that have watched my channel for a long time are like, girl, you keep telling this story. It's like, we get it. You thought you were trans when you were a kid. But I didn't know the word trans, so I just thought I was meant to be a girl. And then I grew up and I am so happy that I didn't do anything to change myself as far as my gender went, or I've clearly changed myself, but I didn't do anything to change myself as far as my gender went or anything like that. And I'm so happy for it because I really do love being a man. And I don't feel like I have to subscribe to any like traditional idea of what masculinity is or what it is to be a man. There are certain things culturally that I've been raised to believe that men do. And I like those. I stand by those. But none of it's like an effort for me. There's nothing about me where I'm being performative in my being male or my being a man. And so I think the more that people grow to understand that and get that you don't have to be any traditional version of what you were born, I think the more we'll begin to see the idea of trans begin to fade away, and then what we'll be left with are the fakers. So let's get to the story and I'll explain as I go. I hope you guys are understanding what I mean because I'm just tired of some of these people, you know, so let's get into it. Like I said, headline is Mother 38 and Daughter 10 reveal their double gender transition to become father and son. I have a real problem with the term father because if you didn't contribute the sperm to making that child, you cannot possibly be a father. Maybe you can say you're a dad or you aspire to be a dad. Let's move on. Let me not get caught up in the minutia. A father and son from Brazil have shared their gender transition story online as they become mother and daughter. Okay, I think they reversed what they were trying to say there. And at first it confused me because I had to read this 2 or 3 times to really make sure I soaked it all in. Raphael and Gustavo Batista, 10, from Sao Paulo, Brazil, were born with female biological characteristics but now identify as male. Okay, that's annoying. Can we just say that they were born female? Because they weren't just born with female biological characteristics. They were born female and now they identify as male, which the more we get into this, the less I subscribe to anybody identifying as anything. You are what you are. If you say you identify as something, I feel like we're all supposed to pretend that you are that. Which is weird because I have no problem with the term trans man or trans woman. I guess because if you're saying you're a trans something, then you're admitting you have gender dysphoria and that you choose to present as something else. And then at that point, I don't feel like you're really asking anybody to buy into delusion You are saying that you deal with a particular type of mental disorder, and that is the way you express yourself. So I guess that would be the difference. Let me know in the comments if that makes sense. By the way, like, comment, and subscribe. We're on our way to 100,000 subscribers. We're right around 73,000 right now. Thank you very much for that. So do your part, hit subscribe. When you click the subscribe, make sure you also hit the bell to select all notifications so that you know every time I upload. Now let's get on with it. Gustavo, and let's remember Gustavo is 10. Gustavo was the first to start his transition at the age of 4, which gave Raphael the strength and courage to also face the transition. Now, who the hell listens to their kid at 4 on this type of thing? And I understand you have to pay attention to your babies, and I understand that you have to treat them like they are talking sense. You know, I have nephews and nieces, and they're all in their 20s and 30s now. My sister was a young mother. We're Mexican. But they are in their 20s and 30s now. But I remember when they were babies, and you try to be cute with them and be sweet with them, and at the same time take them seriously so that they know they can talk to you, or they don't feel like you're constantly condescending or whatever. You know how it is. So they say they have big muscles, and you're like, you're right, you do have big muscles. You know, or you know, they say that they want to be an airplane, and you're like, okay, well, be an airplane, you know, like you encourage them, you know, but you don't buy into that. I never got in contact with an airplane mechanic so that in case my niece or nephew ran into any problems as being an airplane, that we'd be able to take care of that. I never affirmed them as an airplane. It was just sort of like, yeah, you're an airplane, look at you. I'm an airplane too, you know, like, well, I guess this is a different version of that. Their kids said they were trans, and they were like, you know what? I'm trans too. Let's both be trans. Anyway, Gustavo was the first to start his transition at the age of 4, which gave Raphael the strength and courage to also face the transition. Raphael, 38, stopped identifying as female last year and asked to be referred to as male. In September, Raphael posted a clip on Instagram in which he discussed gender identity. Okay, so you're 38 and you have a child that is 10, so you were 28 when you had your child, but then at 4, your child decided to transition. I'm just trying to do the math on this because all this seems really sudden to me. So between 32 and 38, that's when you decided, if I'm gonna be a man, it's now or never. And so we listen and we don't judge. Anyway, Raphael, 38, stopped identifying as female last year and asked to be referred to as male. In September, Raphael posted a clip on Instagram in which he discussed gender identity. The clip was captioned, translated from Portuguese, "If I have dysphoria in my body," and the answer is yes. Asked if Gustavo influenced him, Raphael told G1, "It didn't have any influence, but he, Gustavo, gave me strength and courage to face the transition." The pair share their inspiring story with their nearly 25,000 Instagram followers, and many are supporting them in their journey. See, that's where I think it does fit into the Transhausen idea, is when they start describing it as an inspiring story. And I guess the only reason I have a problem with them referring to this as an inspiring story is because I revert back to my statement in the beginning of the video where I really do feel like, and I know I personally don't have children, and usually I wouldn't tell anybody how to parent, but I would say as a good parent, most of us can agree, that on making major changes like this, you should not at all trust your 4-year-old to be able to make these decisions. And that's where it really is a parent's job to put their foot down and just be like, I don't care how you dress. I'll buy you whatever clothes you want. You want to dress in jeans and a t-shirt all the time, a baseball cap, whatever whatever you want, let's do it. You want to play sports? Great. All of that, great. But transition from a 4-year-old? I wouldn't be surprised if this child grows up to hate their father. The father and son have previously spoken out about people using their dead names, the names they went by when they identified as women. And again, I have a problem with when they identified as women because one of them was a woman, but the other was a little girl. We listen and we don't judge. Quote, even though it is our right to have the social name respected and practiced, respect rarely happens, in fact. The caption reads as translated into English. Gustavo, who is a student, also works as an actor and has played both transgender and cisgender characters in films. This goes with the Munchausen by proxy when it comes to profiting off of the transition. So he's hitting a couple of boxes here, if you ask me. Gustavo is treated at the transdisciplinary outpatient clinic for gender identity and sexual orientation at the Institute of Psychiatry and the pediatric endocrinology unit at the Children's Institute of the Hospital das Clínicas in Sao Paulo. Had to get a little more Mexican on you guys there than I had intended on. Don't get fooled. I don't speak Spanish. In the UK, puberty blockers were banned indefinitely for children under 18 who think they are transgender in December because of safety concerns. The Commission on Human Medicine, CHM, published expert advice that there is currently an unacceptable safety risk in the continued prescription of puberty blockers to children, which also can affect bone density and brain development, or at least that's what the research is leaning towards. And then me personally, like I told you guys, I've had many trans friends in my life. I gotta admit, one of my friends, born female and identifies as male, but I saw him when he was first starting to really, was friends with him when he was first really starting to get everything adjusted as far as the hormone blockers, because he was an adult, so hormone blockers and figuring out what was going on with their testosterone. And that adjustment, they legit went crazy. And I'm not friends with him anymore because it really did mess him up to that degree where he was just so whacked out. He knew that it was the hormone blockers that were doing it. Well, he knew that it was the combination of the hormone blockers and the testosterone and obviously his natural chemistry mixed in with that. But before that, he had been pretty normal and we were pretty cool, not pretty cool. We were actually very cool. We were friends. And I really did like him. But then everything got messed up and it really was a situation where it was like, you're crazy. I cannot hang out with the person that is truly crazy. And I know it's not the trans that makes you crazy. I definitely know it is the combination that's going on with your chemistry right now. But I cannot deal with it. And so we're not friends to this day because they just truly went off the deep end. And I can't imagine doing that to an actual child. I can't imagine as a parent thinking that it's worth the trade-off. Also, another thing is that when your body is developing, if you do plan to eventually live as a trans person once you grow up, you're going to need every bit of your body to be developed so that you can turn into what it is you want to turn into or give the illusion of what it is you want to be. However you would word that, you know what I'm saying? Let's not play with each other. But yeah, so you should let your body fully develop the way it needs to develop and not do anything to stunt it. And people saying puberty blockers are like a pause button, they're really not. And that has been proven. That's not an actual thing. They are definitely going to stunt your growth. And so there's no unpausing that once it's been done. Health and Social Care Secretary Wes Streeting said there is a need to act with caution and follow the expert advice in caring for this vulnerable group of young people. Children's health care must always be evidence-led. The Independent Expert Commission on Human Medicines found that the current prescribing and care pathway for gender dysphoria and incongruence presents an unacceptable safety risk for children and young people, he said. Dr. Cass's review also raised raised safety concerns around the lack of evidence for these medical treatments. We need to act with caution and care when it comes to this vulnerable group of young people and follow the expert advice. We are working with NHS England to open new gender identity services so people can access holistic health and well-being support they need. We are setting up a clinical trial into the use of puberty blockers next year to establish a clear evidence base for the use of this medicine. Well, I don't know why they would be doing that, because the last I heard was certain places are not even using puberty blockers for their originally intended use, which was to prevent precocious puberty, which is when children start puberty younger than they're actually supposed to, and that can have negative effects. But there are certain places that are no longer even prescribing them for that because that's how dangerous they consider them to be. And Dr. Cass put out the report, it was called the Cass report, I believe was what everybody was referring to it as. And it really did have some damning evidence when it came to this. And then there was also a doctor by the name of Joanna Olsen Kennedy, or maybe it's Johanna Olsen Kennedy, what do I know? But that particular doctor had done a 10-year study on puberty blockers and refused to release the results because she didn't want them to be weaponized politically by the right. So what does that tell you? If they had gotten the results that they wanted, don't you think they would have used that to further support their idea that children should transition? Why would you withhold that? How could it be weaponized if it was good news? Dr. Hilary Cass, who wrote the Cass Review into Children's Gender Care and published her final report in April, described puberty blockers as powerful drugs with unproven benefits and significant risk. She said, "That is why I recommend that they should only be prescribed following a multidisciplinary assessment and within a research protocol. I support the government's decision to continue restrictions on the dispensing of puberty blockers for gender dysphoria outside the NHS, where these essential safeguards are not being provided." Yeah, and NHS, if you guys aren't familiar, is government healthcare. And so that makes sense because once you start putting it into private clinics, that's where things get a little bit sketchy. And I know that people are always saying there are protocols and these things are monitored and stuff. Trust me, they're not. Look at my face. I've dealt with enough doctors, plastic surgeons, in general, medical professionals to be able to tell you, and I mean actual licensed professionals. When I put the air quotes, I'm just doing that because we assume that these people, because they've taken a Hippocratic oath, are going to have our best interest in mind and do no harm. But I can personally tell you from actual experience that you can pay a doctor to do almost anything you want them to do, to treat you for almost anything that you want them to treat you for, to give you almost any prescription that you want them to give you. And I'm not talking about every doctor. There are doctors that do have scruples, but I'm saying if you're the kind of person that will doctor shop, which certain parents that have Munchausen will find the right doctor, and certain doctors will lead you down saying the thing that you need to say to get what it is that you actually want, because their goal in some cases is really to make money, and sometimes they have a political agenda too. Like I mentioned, that Dr. Johanna Olsen Kennedy, that person probably has an agenda if they wouldn't release their findings because they didn't want it to be weaponized. Research is research. People should be able to look at it and gather from that what it is they're going to gather, no matter who they are. So that to me tells me that that doctor has a particular agenda. And if you've never been to an unscrupulous doctor, if you tell them kind of what your goal is, they'll usually guide you down. Well, if you had such and such, then I could see that. Have you experienced symptoms such as? And then they'll start listing what the symptoms are that you would have in order for them to have to give you this particular prescription. And as long as you're a good yes person, you're just like, oh, yeah. Oh, I hadn't even thought about the fact that you're right. I never knew how to describe that myself. I was never able to put my finger on it, but what you're describing is exactly what I'm going through. Okay, well, we'll just write you. And I sound like I'm joking, but I'm really being 100% honest. Anyway, my point is, yeah, I can understand how they're saying, like, if it's very specific protocols and being monitored by the government, then there's always going to be a little bit of room for that, but at least there are some safeguards in place. Last year, the Militant Doctors Union sparked outrage by vowing to fight the introduction of the landmark CAS review into NHS gender identity services for children. See, and that supports what I was saying about certain doctors having an agenda, because there's outrage. The British Medical Association revealed it will form its own group of members and trans patients to publicly critique the inquiry's findings and bring its own influence on policy. It is opposed to the planned ban on puberty blockers being prescribed to what is said to be victimized trans children. I have a problem with the term trans children. There are no trans children. Children are children. They'll grow up to be what they're supposed to grow up to be. The BMA's governing council voted to take action in the private meeting earlier this month, but the union only disclosed the result. Leading pediatrician Dr. Hilary Cass made more than 30 recommendations to overhaul NHS services in a bid to improve care offered to trans children. Her report, published last April, took almost 4 years to produce and found children caught in the middle of a toxic row over treatment have been set on a path to irreversible change. She warned evidence of the use of puberty blockers and hormones relied heavily on the shaky foundations, and associated guidelines were not supported by science. The news comes after the landmark CAS report warned children questioning their gender had been let down by the lack of research and remarkably weak evidence on medical interventions. In March, NHS Lothian and NHS Greater Glasgow deferred starting new patients on puberty hormone suppressants and gender-affirming hormones. Then in May, NHS Lothian paused all referrals to surgery and assessment appointments so as to allow for extreme reviews. Restrictions were subsequently lifted. Scottish Conservative Equality spokesperson Tess White, MSP, said, "The number of under 18s referred for specialist procedures is especially concerning. And at a time when NHS waiting lists in Scotland are sky high, taxpayers will ask why such significant sums were spent funding these procedures in NHS England." And that's the other thing. If you want to transition, that should be on you. That shouldn't be at all funded by the state or the government in any way. I mean, call me old school, but that's the way I see it. Anyway, Susan Buchanan, Director of National Services, Director at NHS National Health Services Scotland, NSS, said all patients referred for surgery are carefully assessed by healthcare professionals considering individual patient needs and circumstances. The Scottish government said not all patients who are referred proceed to surgery following their consultation. And so if you notice right there at the end, they just decided to give you a little bit of the history and what's going on with these particular procedures that this mother is putting their child through. And I have to say that I am not at all on board with this, and I really do feel like this is going to turn out bad. Anyway, that's where I'm at on it. Let me know what you guys think down below in the comments. If you want to see a video of me talking about the fact that Stephen A. Smith from ESPN read Joy Behar from The View, click the link on your screen. Other than that, as always, thank you for watching. This has been Ty Rivera, the absolute best LGBTQ comedian in the world.
They bought into his bullshit.